Welcome back. We are live in Catonsville, the 21228. We're at State Fair. Everybody's enjoying themselves. Lunchtime in your place is packed. We will be here till 5 o'clock. People keep bringing canned goods. Bill Coles, anything you want to say to Susan out there who dropped off a whole bunch of stuff? Susan dropped off lemon cake. Susan, I know you're driving a car right now. I saw you, and you came in, and, I mean, like, people are evaporating on me.
Yeah,
you know?
no, it's wonderful. Thank you very much. Appreciate it.
Can I get a slice of that?
Of course. Of course.
We're on day 4 of this. My wife this morning says, I'm not making you breakfast today. You're going to State Fair. You'll eat there. And then I get here, it's 5 and 9, and like I haven't eaten, of course, right? So every night I've been going home with food because, like, most of my clients are Greek, and they just send you home with food. You know, they can't help themselves. So I've got, like, crab cakes, cream spinach, all this stuff. Today she's like, you're going to be at State Fair, man. What are you bringing home? And I'm like, I don't know, but something good, you know, meatloaf or something.
Right.
Adam Rosenberg's been my friend for a long time. He's the executive director of Center for Hope. I knew him under a different name in a different way, but I've toured facilities. He's done a lot of things here for children and for helping people who need help the most and come in the most vulnerable times. You can find out all they do at Center for Hope. Find them through LifeBridge. He is Bill Cole's friend. And Bill, you give an introduction here because I've known him a little. It's Baltimore. I know him. You know him. We know him.
We all know each other, right?
Yeah, I mean, literally, it's the way it is.
I think my short summary for Adam is we got to know each other, and once you realize the type of work you're doing, I am constantly trying to channel my inner support so that you just feel that whenever, because I can't imagine your days, and you just should
Every
know.
day
I love
there's
that.
a
I appreciate
tragedy
that.
and awfulness that comes to your front door, literally.
You know
right?
that
Like,
there's these people behind you with their hands
you.
on your back, keeping you afloat.
And there's
because
great things
it's
we can
needed.
do about it. We shouldn't let it defeat us. I think there's a way to be able to overcome that, and anyone can overcome trauma with the right support system there. And it's great to have support from guys like you and your listeners here who want to believe and make Baltimore a better place.
what is Center for Hope? I got a whole book here, so I'm going to have you get this down in about 16 to 18
So
minutes.
Center for Hope is a first-of-its-kind violence response program in the nation. We're working through LifeBridge Health, and we're taking a public health approach to all forms of violence: child abuse, domestic violence, elder abuse, and exposure to gun violence there. We recognize that when someone has been impacted by violence, living with child abuse, witnessing a homicide, being a part of a domestic violence relationship, it impacts your health outcomes. And as a health system, our job and our desire is to keep people healthy, keep them out of the emergency room, and to give them healthier outcomes there. And so through our services, through our counseling, through our network of support, we're able to turn that trajectory around for over 7,000 people each year to prevent people from further future adverse experiences from violence.
So how do people come to you? What's the entryway? And when you find them, what's a... I don't say typical, nothing's typical.
Nothing's typical about this. People come to us through a lot of different ways there that we've been, and we still are what was the Baltimore Child Abuse Center, the city's child advocacy center. So if anybody reports abuse in Baltimore City, they work with police, they work with law enforcement and social services there, and then they come to us for us to provide a coordinated investigation there. It takes someone to pick up the phone and dial 911 or Child Protective Services to be able to report the abuse, but once that's come in, we provide medical management, we provide free therapy, we provide case management for those kids. People also come to us through our hospitals. So someone presents at Northwest Hospital or the whole west side of Baltimore with domestic violence, we're their response team there, and so we're helping them get out of that domestic violence situation, find shelter, provide some free legal representation, provide care while they're in the hospital. And then most excitingly, and really probably the biggest challenge of our career has been, we took on administration of 6 of the 10 city's Safe Streets sites. And despite what you might hear on some media, it is a remarkable success program. So much so that our 6 Safe Streets sites, through over 900 community events and interventions, has been able to impact a 28% reduction in gunshot wound admissions at Sinai Hospital. Fewer people are getting shot because our team is intervening and working with a lot of community partners there to make sure that people are living and not dying.
Well, I was at Fadley's to start the week, and, you know, I think when I began this whole journey about Super Bowl, a cup of Super Bowl, and I'm not going to be in Las Vegas, I'm only going to be talking about local issues, the one thing that came up real early on Monday was, hey, man, less murders last year.
That's right.
I mean, we love talking about when it's more and more and more and more and awful and crime and harm to more and all the names they make up. But, like, Yeah, we got to talk about that a lot. We got to say that a lot.
We have to say that there is less crime in Baltimore. There are fewer murders. There are fewer shootings there. And I think it's some of it's a public perception thing. And it takes time. That this past year has been a remarkable year. We see the Orioles over 100 games, right, and becoming a championship contender. We see the Ravens in a championship run. And this is our championship run when it comes to ending violence in Baltimore. It takes years. It does not happen overnight. And it's through our work and the partnership of Catholic Charities and other organizations like Roca and We Are Us.
Monday.
We're all here.
We had Bill McCarthy here Monday.
Sure.
You
I
know?
mean, we're all in this.
Well, I hear a lot about Roca. I hear a lot about Safe Streets. What should people know about Safe Streets in a general sense? Because it has been this malign thing, and the young man who was murdered last year that was one of the coordinators was a name on. He was on my hit list to get as a guest.
Right.
I tried to put guests together and say who's making an impact. Next thing I know, the kid's murdered, and I'm like, oh my God, like what's going on?
Look, these guys are heroes. I mean, that police officers go out, they get benefits, they have a union, they have bulletproof vests, they have vehicles, they have cars. They go and they're interceding in violence. These are guys who are looking to give back to their community, who are credible messengers, who may have served their time and have demonstrated that they are out to reform their neighborhoods there. And they're getting between two people, and they're saying, you know what, stop shooting, let's find another way to resolve this there. They're working within the community to get the resources for people who perhaps want a job, perhaps don't want to be slinging drugs, perhaps don't want to be involved in violence, to deter them, to interrupt violence. And by taking a 30-year model called Cure Violence, where we're taking the same approach we take to healthcare, that violence is something that can be cured. And so these teams are doing great work. And you know what makes them maligned is the fact that, we're using people with previous histories there. And those are the people who have the most experience in this. Your drug counselors, they're by and large peer recovery people who've had their own addictions there. And so we need to be working with people in the same vein who have those lived experiences to be able to advocate for violence intervention.
Adam Rosenberg's here. He's been doing good work for a long time. Bill Cole from Cole Roofing and Gordy Energy, riding shotgun. We're at State Fair, collecting canned goods for the Maryland Food Bank. We'll be at Pappas on Friday. Get here before 5. You get a free cup of soup or bowl for your donations, and it's going right to a local pantry here. We're going to meet them a little later on as well. You mentioned, I remember being in your place years ago. You talk about children being abused, sexually assaulted. You talk about kids getting beaten, the cops come, right?
Right.
And the cops come, and they're like, oh my God, the wife and the husband and the child, and we need to remove that child, right? That's when I think about you. Like, you know, what Bill talks about, this horror story that's all you do. I mean, that's what comes to your door every day,
right.
Is that in some awful, it's all awful, and then you have to unravel it and figure out what to do for that child. I've done orphan today here at the Children's Home. I've done, all sorts of stories this week about policing and things. Well, you've experienced this so many times. And it's something we don't talk about. It's something I don't even want to talk about.
I think it's something we need to talk about along the lines of these other ailments and illnesses that we all make efforts and do runs for, whether it's cancer or diabetes or heart disease. That child abuse is something that happens on a regular basis within our communities and can be stopped there. And through education, through lessons, through working with schools, to giving your youth-serving organizations and your instructors the tools necessary to figure out what's appropriate behavior and what's inappropriate behavior there. A lot of that you can get for free, by the way, on our website at reportabusemd.com. We have a free training there so you can learn how to recognize abuse and how to report it and how to prevent it from happening in the first place.
Well, the former name of your organization, Moving to Center for
we were
Hope,
the Baltimore Child Abuse Center.
Baltimore Child Abuse, that's when I think about you. I think of child abuse, not in the bad way, but in a good way. Center for Hope is the extension of that?
It's the natural growth of it there. When I'm fortunate to be able to work for an organization like LifeBridge Health and have a CEO like Neil Melcher, who truly, we live the motto of caring bravely. And that Neil saw the opportunity to use health systems to be able to impact and preventing child abuse. When we looked at our data, we had many kids who were going to end up at Sinai Hospital or Grace Medical Center one day if we didn't do something there. And so Neil and the board at LifeBridge Health invited us to join the organization, and that's what evolved us from Baltimore Child Abuse Center. January 2019 now.
So it's right before the plague.
Right before the pandemic, which has stalled our launch. And even through that pandemic, we launched Center for Hope. We brought all these violence programs together. And most excitingly, we built a brand new building, the Jill Fox Center for Hope, right in the shadow of Pimlico. So it's half a mile from Sinai Hospital. It's the gateway to Park Heights. And we have a brand new service facility center to be able to help thousands of people each year who've been impacted by violence. Come by and see it.
Yeah, I just think that Adam, for me, is that like boots on the ground. So like whatever you want to hear, to your point, right? Like less murders. Like we hear all the stories. Adam always has a way of like really grounding the stories to tell you exactly what's happening. When we talk about what's missing, like how do we add the services? How do we roll this? Like just the stuff, and you never even think about these things, right? And then he tells you how they're doing this.
You don't want to think about
right.
it.
Yeah.
I mean, people don't want to think about this.
And then I'm always blown away at sort of the holistic thought process that goes into what do we do when the 911 is called or this person enters our sphere? How do we get them from the starting point of a rebuild, to a good outcome? And
what are your success stories? I mean, you've had children come to you in the worst way. Do you see them as a 9-year-old abused and then come back as a 19-year-old as a freshman in college and you're like, wow?
I've met that kid. I've met that 9-year-old who was a victim of abuse when I was a prosecutor many years ago and watched her grow up.
That's your background. Your background was I didn't know that.
Yeah,
okay.
I started as a prosecutor. And look,
this pissed
honestly.
You off.
Well, I think it actually
pisses me off
it
thinking about it. It makes me
me.
want to be a prosecutor.
Look, it inspired me that I think we can use the system.
Put your ass in jail.
That's exactly right. But but what it showed me also is that the criminal justice system wasn't the end all be all on it. That despite a guilty conviction, a sentence, that there was still a life to be repaired, and that's where Baltimore Child Abuse Center came in. And for my early days,
everybody, right?
And even if you punish them, it's not going to make the kid better, right? It's not going to solve that mother's situation where her husband, her breadwinner is in jail, and they need to get back on a path there rather than fall into further disrepair. And that's where the Child Abuse Center had come in there, and I've been working with them since 1997 now.
The father's still going to be the father, even though they beat the kid.
And that's part of it too. Is we have to find a way for almost reconciliation because that guy's coming out of jail at some point, and he's still the father. And so it's so much more complicated than just a sentence, you're gone, because these are lives that are very intricately linked together there. And so
is that why you got in this work? You got tired of being on that side, thought I could
I thought there was more I can do, and I was so inspired by how the Baltimore Child Abuse Center, now Center for Hope, can do things. And it just, there's so much more that was needed than just a conviction. Very important part of the process there, don't get me wrong, some of my best years of that. But yeah, I've seen that success story where the work that we have and the impact that we have on these families, and they tell us that but for our help, our services, our free counseling, our medical services, they wouldn't be where they are today.
How can people help you? I mean, I think LifeBridge, I think that, that's nice that you've been funded in that way and been associated with this larger thing than I remember you sort of
struggling.
Hey, look at me. You were down on Charles Street, right?
Right, we were on Charles Street. We were lucky to make payroll some weeks,
right? I went upstairs and I'm like, oh my God, a woman's been raped, a 14-year-old child's been raped, and they walk in here and their lives are torn apart, and you got to meet them, greet them, settle them, heal them.
And we're there for 30 days or 3 years.
Find a safe place for them, right?
Right.
Because home's not safe for them.
So how can you help? So look, obviously the real cheap shot is, look, you can make a donation. You can go to lifebridgehealth.org/hope, and you can go to our donate page there, and you can make a donation there. Other ways you can help is if you know of a family that is in need, of assistance, is ask them, can I help you out there? I mean, I think we need to get back to neighborhoods and community there. I think that if you're in a school system, in a school setting, is making sure that you're asking, what are you doing to keep my kids safe? And if you're running a school setting, to think about it and say, hey, what are we doing to keep the kids safe in our program? Are we training everybody who's doing this there?
Keeping kids and families safe, community violence intervention, addressing interpersonal violence, advocating against, I'm reading page by page, art collections, be a
imagining
hero.
hope. Mm-hmm.
There we go. All
Nestor, I want to just emphasize one thing that he said earlier, which I thought we kind of ran by really fast. The idea that a hospital system looked at a proactive way to limit the number of people that were coming in by investing in the Center for Hope. Like, that is just, that's a really different way of thinking about.
We don't want to see kids that have been raped in our emergency room.
Correct.
We don't want them getting hurt at all. We don't want them ending up in the emergency room. Here's the long-term impacts of that too. Thank you for bringing that up. Is that when that child has been a victim of childhood abuse, childhood sexual abuse, childhood physical abuse, and they don't get the help that they need, the preponderance, the rate of them becoming a future victim of violence increases, the rate of them becoming a perpetrator increases, but even the other health impacts of their rate of possibly having cancer, diabetes, heart disease, other adverse things in life that happen because your body is still in that fight or flight mechanism there. And so it's constant traumatic stress syndrome. And so it ends up making them unhealthier as they go forward there. And so we know as a health system, we want to keep you out of the emergency room. We want to keep you healthy. That's what health care should be about there. And so, it's been really innovative for a health system to make that kind of investment in us and help us catapult us on another level there. And don't get me wrong, folks, we still need your money. that, I think that just
Right.
because we're part of a health system doesn't mean that it's a free check there. That we
Well,
still rely on donors and people to make this thing happen.
You said 7,000 people.
Yeah.
Wait, what could the number be?
Oh, I mean, the number could be. I mean, there's so many more people.
Tens of thousands.
Right. We've got people
in our community.
both
right,
unreported and not getting help. That I've got a remarkable team of mental health professionals who are trained in trauma, and they just completed a play therapy class this week. It's the most adorable thing I've ever seen. They're literally they're making collages and they're playing with toys. But these are the tools that help kids recover from abuse there. But their docket is full, that they don't have space within their case management system to take another case. Right. If I had another 6 therapists, we could help another 800 people. I mean, it's incredible the way that this can scale up if you have the people available to do it.
Adam Rosenberg's trying to do that with Center for Hope. They're right up by Pimlico. Hi ho. Your dress is Preakness Way.
That's right.
So we got a horse race coming up here in May. Bill, are we good?
I think we're good. No, I think that was great. Yeah, I mean, it's about awareness. You just got really, people should just listen to that again because there was so much stuff in there about community building and how to take care of your neighbors. And, there's a lot of good stuff we just hit at a really rapid pace. Well done.
That's how I move.
No, super good.
And look, Bill's a great example, you too, Nestor, of, people saying, what can I do to help? Rather than turning your head and saying, not my problem.
He's a sports radio guy, dude, right? I mean, seriously. Right?
Right.
I mean, right? But he's a Baltimore guy and I'm a Baltimore guy.
Right.
I can sit here and talk Ravens with him, Orioles with him, food with him, business, leadership. We do all that stuff. But, this was a week for me about, breaking out my Jerry Lewis and saying, all right,
how do we build a better Baltimore?
I'm reaching all these people. If I'm going to get thrown out of doing Radio Row, I might as well sit here and have Crab Cake Row.
Right.
Weather's better here than it is in Vegas. We didn't make the Super Bowl. And I thought, what are the stories that are impactful? And the people I met like you, that it becomes a natural thing to have you here today.
Thank you.
And I've met some strangers and some people I don't know or people I've met once or twice. But by and large, I know a lot of people doing a lot of good-ish here.
Yeah,
right?
There's a lot of great things happening in Baltimore, and we need to talk more about that, too.
That's Baltimore Positive's all about, dog.
Yep, that's right.
How about them
Boom.
Orioles?
Yeah.
There you go. All right. We'll talk some baseball
Thanks,
later.
guys.
We got the rest of the summer to do that. We have till 5 o'clock here to get donations for the Maryland Food Bank. We have a whole table full of stuff over here. Susan's leaving canned goods and lemon cake. Was it lemon poppy seed? What was it? Do you even know?
I'm not sure.
It's got to be
I've
poppy
got to
seed.
dive in
Cut
there a little
that thing
bit.
up.
Yeah,
let's go.
let's taste
go.
it.
Dive
Yeah.
in there.
It's not going to make it home.
All right.
And we got who's coming up next?
Sisters Academy. No.
Sharp Dressed Man.
Yes.
Sharp-Dressed Man.
Sharp-Dressed
Yeah.
Man. Thank you. Sisters Academy
He is
after that.
sharp-dressed, but
He
it's
is.
not Chris Schaefer. I wonder if he plays the drums like Chris does.
Right.
Yep.
Does the hot rod thing, and the Chris is always skateboarding. Chris Schaefer couldn't be here. We're going to do Sharp Dressed Man, which is really something I've donated to. So I've donated to Chris.
I've donated them too. I've given them clothes. Yeah.
I've had some.
And I think when people get a fresh start, they need a new jacket. They need a new suit.
Well,
It's a
what he
great
said.
program.
I'm the original Sharp Dressed Man. So anything you want to
Everyone's
donate
crazy
to.
about a Sharp Dressed Man.
Absolutely. All right. Leonard Raskin couldn't be here, but he left me. I call this the Richard Scher gavel. Remember Richard Scher used to do square off? It is actually a crab mallet, but dude, Raskin's in Maui right now.
Yeah,
He's
I
in
don't really wanna
Wailea.
talk
It's
about
breakfast time right now.
That's not cool.
Yeah, well, it's his 30th anniversary. He's allowed to.
All
'Cause
right,
he's
fine.
been taking care of his money.
That's
He can take
actually
care
really
of yours
cool.
as well.
Give him a call. Wake him up.
By the way, I didn't even. Did I Oprah you? Did I give you one?
No.
10 times the cash from a Maryland lottery. They are our sponsors. They put this thing on with Window Nation, 866-90 Nation. I'm getting doors. They do windows. I have a wacky hat. I'm going to put it on just for fun. It also has this tab that hangs out of it like spaghetti. Also, Jiffy Lube Multi-Care, taking good care of us. We're going to be at State Fair till 5. We're going to be at Pappas in Cockeysville all day tomorrow. My wife thought I was going to lose my voice already. So I'm, let's see,
Holding strong.
24 and 5, 29 hours into this grueling event. Coming to the zoo.
Go to the zoo.
Ice
Go to
down
the
the beer
zoo.
for me. I'm coming. Back for more at Catonsville right after this.